So our clinic it's a good place to call home. It's a nice environment whenever you're coming back from whatever rotation you might be on, and you kind of have a sense of like coming home to clinic when you have whatever clinic time. All of the clinic support staff and preceptors and stuff are always welcome faces. Our patient panel is it's extremely diverse. We have people from all walks of life, many different languages and nationalities are represented in our clinic. People that have diverse goals from severe chronic illness to wellness and prevention, and people in younger ages, people that want to thrive into their old ages. So yeah, I think we have a great diversity and a lot of interaction with underserved communities, including homeless populations and people that have less means in general. But so I think you get to see and work with people from all walks of life. So our didactics and kind of scholarly activity schedule is it's nice, and I think it's integral to the way that we all feel so well connected, because rather than having like certain days of the week or saving things up, we meet every day and have lunch together at the noon hour, and then once a month we'll have an afternoon where we're like digging down on a certain topic. So I think that's great in just allowing everybody to touch base with each other and stay connected to the group. And then our scholarly activity and kind of quality improvement stuff is it's super well supported by our library resources. We have access to anything that we need. It's really driven by the individual, and there's always plenty of work, like in any hospital system or clinic or residency program. There's always plenty of things that need tending to, need improvement, and then we have the ability to tailor that towards our personal interests with any resources we need. The feel of our residency program and our group is it spans the range and balances nicely, being heavy-hearted and being lighthearted. I think we're all dealing with serious concerns, people's health regularly on a day-to-day basis, and at the same time, we have a jovial environment when we do get together. So everybody's friends, everybody's amicable. We try to find ways that we can spend more time together. And at the same time, when things get more serious or if somebody has a problem, it's also supported by the group, and it's not a situation where people will like wall off. It's kind of like we deal with our problems all together. We're all helping each other out and enjoying each other's company. So if you're looking for a program that is not specifically defined by one thing, but is potentially characterized by all things, and family medicine is along that line, where you'll be supportive, you'll be part of a close-knit group, you'll get diverse experiences, and allow your training and education to follow your desires, then you should come to Skagit. Yeah, we've always kind of had this tradition of getting together, doing things outside of the professional setting, and that's why, like, during COVID times, I think we felt it more because we were lacking something that was existing before. One thing that we do is OMT get-together, so it's a social event where we get together at somebody's house, generally like quarterly, so 4 times a year, and do some OMT together, also just socialize. It's not like a structured environment. Every month we have a social event that is put on with the internal medicine program. So it's kind of a standing event, one Saturday out of the month that whoever can come comes. We've done various things like just going to breweries and restaurants, hikes, paintballing. So there's that. Then our more formal retreat is our whole family medicine program together with our families goes to Guaymas Island, which is it's right behind me, but it's not far away. And we spend a full weekend together, and everybody gets individual cabins or group cabins depending on their party. And we just have fun, and we talk about, what we're thinking about with the program, reflect on things. So Skagit Valley is, I was a little confused why I didn't know more about it when we came up here, and then I learned that I think it's a sort of an intentionally kept secret. We're about an hour north of Seattle, and you start to get away from kind of all the suburbia and the downsides of an urban environment, and get into more of a rural setting where you're engaged with the outdoors just naturally by being here. There's plenty of resources. There's big towns north and south of us, but we have the ability to get outside quickly. I'm blown away by the beauty every day, and then the ability to do outdoor activities. It's right at your doorstep. So no matter what you like, if you're into being on the water, streams or oceans or lakes, being on the trails, the hiking's amazing, mountain biking, the agriculture here is amazing. Pretty hard to beat if you're interested in the outdoors. So you'd be a great fit for this program if you are open, hardworking, enjoy close, genuine relationships, have a level of honesty and commitment, and broad interests, with maybe some specific passions, then you'd be a good fit for this program. In the last year, I have been most proud of our collective resilience, and I've been proud of our new residents, as our program's been growing steadily. We've had new faces around, and I'm proud of our ability to keep our core of who we are as a program, with little additions of every new person that comes.